Hey everybody, it's Dr. Adam Langan, and I'm here today to talk about a situation that sometimes comes up when we're working on hybrid dentures for people, fixed hybrids that are going to be supported on implants. Occasionally you can't load with an immediate load, and so you have to put them into a denture, just an interim denture for several months until everything is fully healed and we're ready to attach. It's somewhat easy to translate that vertical dimension and bite position when you've got a fixed hybrid in place, but the problem becomes, how do you transfer that information when you've got a removable hybrid or when you've got a removable denture and you want to replicate that vertical dimension and the aesthetics of what you have in the mouth? Well, I'm going to show us a couple of different cases today. One where both of these patients are wearing interim dentures. One is for an upper arch, one is for a lower arch. One of them I was smart enough to remember before the patient left to scan digitally his existing denture. The other patient completely spaced it off, and we didn't make that scan, so it's going to take us an extra appointment to finish her case. But I'd like to show you kind of what the plan is and what we're going to do for each of these patients. So the first patient is a gentleman. He had 4 implants on the lower arch. We took it out, grafted, waited several months, placed another implant, and wouldn't you believe it, that implant failed again in that location. However, we have 3 solid, stable implants, and so at this point, the patient has elected, and I have agreed, that it's one of the middle implants. We still have the same AP spread. We're going to go ahead and restore this lower arch hybrid denture on 3 solid implants. We have the 2 most distal, which are tilted, and the anterior, which is a vertical implant. We're going to go direct to implant platform on the anterior one, and we're going to go with 2 multi-unit 30-degree abutments in the posterior. The other patient has 7 maxillary implants. She's been wearing an upper complete denture for about 6 months or so. Everything has fully healed in her case, and we are going to go direct to implant platform with non-engaging abutments in her final hybrid fixed denture. So what you'll see here now is that we've got our 2 separate cases. I've warmed up the wax rim, and it's a little bit wet here, so it's still moldable and pliable, and we're going to get to that in a minute. This is our female patient. She has 7 implants that we're going to go direct to implant platform. And then this is her model. We've blocked out the 5 of the implants just with some cotton pellets, and then put interim abutments onto 2 of the implants, and then just put some broken off cotton tip applicators in so we don't block those with wax. We're going to make a wax rim for her in a little bit. The other patient, I was smart enough to remember to scan his interim denture, which was already relined over the top of the healing abutments. That was easy then. We just printed it in NextDent MFH resin, which is approved for intraoral use, and ground some holes in the underside, and then ground off the flanges as well, just to avoid any interference on our model. And we've got 2 multi-unit abutments and 1 direct implant platform that we're going to go ahead and attach these 2. So it was really easy. All I had to do was grind a hole in each location on the posterior, put some temporary abutments in there, and then pick them up with some core build-up material. This is going to be basically just a try-in verification that the bite is correct. We'll take a bite registration over the top of that, and then make sure that everything is correct as far as speech and everything would go. Luckily for this patient, this will be his second to last appointment. The last appointment will be delivery. So we will go straight from verifying this to delivery. With this patient, unfortunately, we forgot to scan her upper denture before we let her go. So we're going to have to take 1 more appointment to get it complete. So what we have now is the wax rim, and I'm just going to go ahead and get it molded over the top of this and show you what we will do in a traditional sense to figure out the vertical dimension and midline and all of that. All right, so now I have the wax rim adapted around those interim abutments. Just took out the 2 little pieces of the cotton tip applicator so that my screw access holes were still visible. Now we'll be able to smooth that up and get it to be comfortable. We'll do our traditional MMR type of appointment where we'll adapt this wax rim to fit her face, make sure we go through all of our speaking sounds and get the occlusion set. We'll take a bite registration over the top of that, and then we'll be able to mount this model against her lower model and be able to go to basically a wax setup type try-in, which will be 3D printed for her visit following, and then we'll go to the final hybrid denture after that. This method saves us an entire visit, so my biggest recommendation is don't do like I did. Don't forget to scan the digital denture, or scan the denture digitally so you can print it out and make a really quick and easy verification jig to make sure everything fits and occlusion jig. So that's it for now. Thanks for tuning in to the Digital Dentistry Institute. Look forward to seeing you guys at future courses.